There's never been a time ever where we're potentially facing our healthcare service being completely overrun. And you look at what's happening in Italy. It's like a horrific war situation. Making decisions, for healthcare professionals to go, who's going to get a ventilator and who isn't. Doctors and nurses, that isn't what we thought we were signing up for. We've got to remember that while we're facing COVID-19, healthcare has to continue. People get sick, people have issues, and we can't drop the ball on that. So we need doctors for backfilling. And nurses. We're going to need doctors and nurses for fever clinics. We need doctors and nurses for telehealth. And down the track, we're going to need nurses and healthcare workers for managing people in the community if this thing grows as we think it might. Based on the number of doctors registered and nurses registered in New Zealand, we know that there will be thousands, potentially tens of thousands, who are retired. That's a big workforce that could potentially help in this situation. That's why we are launching this initiative. We've partnered with the Ministry of Health to help coordinate the mobilisation of our medical workforce. We're looking for any doctors, any nurses who are able to help, whether it's in a short-term capacity, in a long-term capacity, whether they're registered or not. We have a way to actually fast-track registrations with the medical and the nursing councils. They've been fantastic to get ahead of this curve. So we're looking for, the call to arms is for anyone who's available to help in any capacity. As we know, this thing's moving so fast. If we go at the normal speed, we're going to be well behind the 8 ball. My message to retired doctors and retired nurses who might be able to help is, this is our time. This is our time as a community, as a medical community, to step up. We have an opportunity here to get ahead of the curve, to be ready to face an unprecedented demand for our services. And I would encourage you to, go to medworld.com, register there. We'll put you through the right process to be ready to deploy. And there are multiple ways you can be deployed. If you're worried about staffing a fever clinic, then we can backfill you into hospital roles. There are telehealth roles. There are a myriad of ways that we can actually help. But as a medical community, this is the time where we're better together, where we come together and we can take positive steps to be a really, really positive part of the response to this crisis.